Jeffrey Potoff from UW Health, and I kind of want to break down this reinfection rate with people who have been vaccinated, have been boosted, and they seem to get COVID again. What's your advice for them?
Yeah, with these very contagious Omicron subvariants, particularly right now, BA2, people who've had COVID in the past and people who've been vaccinated, even boosted, as the weeks go on, their susceptibility to severe disease is still, very low. They're probably not going to get very, very ill, but their susceptibility to any symptoms at all goes up quite a bit, such that even though I'm vaccinated, I'm boosted. If it's been, 2 months since I've been boosted, I'll likely have some symptoms of COVID-19. Likewise, people who were infected with COVID-19, if they get reinfected, it's likely they're going to have some symptoms too.
And when it comes down to the 1 million U.S. COVID deaths that we kind of have broken record here, what does that number really mean? I know a lot of people are impacted, affected by COVID as well, but I mean, this is just such a large number.
I think it's really hard for any of us to wrap our minds around what 1 million deaths looks like. And not just the people that died, but their families and their loved ones who no doubt are still suffering. I also hope that, as we look back at how we manage this pandemic, we're really good about writing down lessons learned so that when our great grandchildren need to fight the next pandemic, they can do it better than we did.
Dr. Potoff, do you have any concern about not having enough funding when it comes down to vaccines?
I worry about people having accessibility to vaccines if there isn't enough funding. This isn't just a problem for those people who can't afford the vaccines. We know that if we have a lesser vaccinated community or a population, we're more susceptible to more severe disease. So it really is a team sport when it comes down to vaccination, and anything we can do to make it easy for folks to get vaccinated is a big plus.
Now, will this COVID booster be more so like a flu shot where you kind of need it every year? Is that something that they're going to be targeting different variants moving forward?
Yeah, I think it'll probably be both of those things. I think as we move forward and the virus changes a bit less rapidly than what it's done in the first 2 years of the pandemic, I think it's reasonable to anticipate an annual COVID-19 shot. It'll probably match the most prevalent subvariants that are out there at the time and be very much like our flu shots, potentially even combined with our flu shots so that we just get poked once instead of twice.
And lastly, for the J&J vaccine, I know a lot of people who have had it or prefer that shot are now a little bit worried that the FDA is kind of restricting who should get that shot. Any advice on that front?
My message to people who've gotten the J&J shot or prefer it is that it's still a very, very safe vaccine. We knew shortly after it was released that it had this very small risk of blood clots. Now with a year's worth of data, we know that the Moderna and the Pfizer vaccine are a bit more efficacious or more effective, and likewise have a little bit lower risk of adverse events. So if you can get the Moderna or Pfizer, probably best bet. If you can't and you prefer the J&J, certainly nothing wrong with that, just not preferred at this point.